Good afternoon, and welcome to another episode of CTLN Opinion Plus, where we have conversations about issues and concerns of the Latino community. Today, we are joined by Ted Doolittle, State Healthcare Advocate, Office of the Healthcare Advocate. Thank you, Ted, for joining us this week. How are you?
I'm great. Thanks so much for having me.
Thank you for taking the time. So today we will be talking about what your office does, what it offers, a little brief summary of the company mission statement. How do you guys have managed the pandemic, concerns in the Latino community, and what is the process of when a complaint comes in? So let's start with our first question. Can you give us a brief summary of what services your office provides? What is the company's mission statement?
Sure. Well, we are a state government agency. It's called the Office of the Healthcare Advocate, and we have a staff of nurses, attorneys, paralegals, and others whose main function is to represent people who are fighting with their health coverage. It can be a private insurance company, or it can be Medicaid Husky, it can be Medicare, it can even be a healthcare sharing ministry or some other non-traditional type of healthcare coverage. Any way that you get health coverage, we have a staff, again, of case managers that can advise you and help you for free. And if needed, if you fill out the right forms, we can represent you for free. Say you've had a claim denied from your health insurance company, and you're sick, and or you're trying to take care of a loved one who's sick. You don't have time to fight the appeal. If you give us the proper authorization, if you sign the proper forms, we can assign a case manager to do that for you. Any other types of issues that you're having with your health insurance, be it a billing issue, or they say you're not covered and you know you are covered, any type of issues with your health coverage, we can help you with. We also, to an extent, help uninsured people negotiate prices with a hospital or other care provider. So we're a free service funded by the state. I often call it the best kept secret in state government because people don't know about it, but it's vital. It's a rare service. Not many states have it, but you, your loved ones, and your neighbors, we want to help you with your health insurance for free.
That's awesome. That's really great information. Now, with the trying times, the pandemic that we're going through right now, I would like to know have there been any trends and complaints that your office has received after the pandemic? How has the pandemic impacted the communities your office is serving?
Yeah. Well, initially, when the pandemic first started, I thought we were going to be flooded with a lot of complaints from people with seeking COVID treatment that wasn't getting covered. But it actually turned out not to be the case. Most of the insurance companies acted quite well and covered the things they were supposed to cover. And also, as you may know, there was also some federal programs to help uninsured people with the coverages. So I thought that we were going to get a flood of COVID-related cases. We really didn't. And of course, as you remember, when we were all on that tight lockdown, nobody was getting a hip replacement. Nobody was getting a procedure. So there weren't so many denials. And so there weren't so many appeals. So the business at the hospitals went down, except for COVID. And the business at our office declined somewhat as well. Now it's bounced back a little bit.
Okay, but what about the health coverage insurance? A lot of people, did they lose that with the whole pandemic?
Yeah, absolutely. When people lose their jobs, often that means you lose your health insurance, and that's a huge problem. There was a lot of help in the federal legislation, the federal laws that were passed to deal with the pandemic, the American Rescue Plan, and but as you know, millions of people around the country and in Connecticut did lose their jobs. There are parts of that rescue package to help people who lost their job. For instance, free COBRA, which is the way you can continue your employer health plan when you get laid off. That normally is very expensive, but temporarily, because of the pandemic, that became free. And also insurance on the exchange, the Obamacare exchanges, which in this state is called Access Health CT. the expenses for that went way down because there are new federal subsidies. But we actually have a lot of resources for people who've lost their coverage, Maricela, on our website, ct.gov/OHA.
Well, that's good to know. Now, you know that there's more than 500,000 Latinos living in Connecticut. How does your office specifically reach the non-English speaking Latino community? How do you guys make them aware that your office is there to help them out?
Yeah. Well, we are the best kept secret in state government, not just for the Latino community, but for everybody in the state. So that's always a challenge, trying to get our name out. Of course, we have taken care. We have a staff of 17, and we've taken care to make sure we have bilingual language skills. We have 2 native speakers and 2 other fluent speakers, so that's 4 out of 17. So we're well equipped to handle our clients in Latino community. But we are always looking for outreach opportunities, be it at a church or any other event. I myself will go anywhere, talk to anybody about the services that our office offers. Obviously, we've had to do a bunch of that virtually.
A lot of work.
Yeah, we used to. There used to be health fairs, and we would go and have a table somewhere. Now that is all much reduced because of the pandemic. Hopefully we'll get back to that. But in terms of, now we've started to do a few press events and so forth in person. And, if we can safely do an in-person event, we're available to do that. Right. But also we're definitely available for video events, conferences, and, helping any community group that wants a presentation.
That's good to know. I would like to know if has your office seen any specific concerns generated, from the pandemic? I mean, my question would be, have you seen any specific concerns generated from the Hispanic community?
I think that I guess I would say that really the challenges have been shared across all communities. Now, there's a little bit outside the lane of my office, which is the health insurance, but we have spoken out publicly quite a bit on the vaccine rollout and vaccine equity. And we've been strongly trying to push the governor in that direction, and have had some success in terms of making sure that we get the vaccine out into the harder to reach communities, or the communities where it's not people are not able perhaps to take time off from work and so forth, try to bring the vaccine to their community. So we've done some work around that.
Well, good. Now, I would like to know, what is the process for someone who submits a complaint, or for someone to have their case reviewed? Can you walk us through the process? And then what's the time frame to have a final determination?
Sure. So you can reach us the 3 main ways. You can email us at healthcare.advocate@ct.gov. That's healthcare.advocate@ct.gov. We also have a phone line, which is 866-466-4446. Again, that's 866-466-4446. Or you can go directly onto our website, which I mentioned before, which is ct.gov/OHA, ct.gov/OHA. And through any of those mechanisms, though, you will be connected with somebody who will gather some information from you. And then if it's something that can't be solved in a quick phone call, and you need some type of representation, we will send you, usually electronically these days, but we also have the hard copy mail. We'll send you the release of information that you have to fill out to allow us to talk to your insurer, or to talk to your doctor or other healthcare provider. Obviously, your doctor's not going to talk to anybody outside of yourself without that release. So there is some paperwork that needs to be filled out. But once that is accomplished, we'll connect you with one of our case managers. And in the case of Spanish-speaking clients, with one of our Spanish-speaking case managers. And then you asked about timeline.
Right, the time
It
frame.
ranges so much.
Wow.
You can have a simple call with somebody who
Right.
perhaps they're new to insurance and they get a bill and they say, oh, why did I get a bill? I'm insured. And then one of our folks might just have to explain to them what a deductible is. Guess what?
Right.
The bad news is you have to pay the first $1,500 before your insurance kicks in. That's just going to be a phone call, right? And that can be resolved immediately. On up to folks who have a child that needs a ventilator in the home for the rest of their life, and there can be ongoing claims. And in some cases, we help families that have one or more chronically ill folks over a period of years. But typically for, let's say a garden variety, I had an ER visit, my cast wasn't covered, and you are smart enough to get to us immediately, and we'll take the ball from you and represent you from then on. It depends on the different appeals levels and structures. Each company is a little bit different too. The timeframes can be different, but you can think in terms of, usually a simple claim is still going to take a couple of months or a month to resolve, in terms of making, perhaps our nurse has to review the medical records, and then we have to write a letter. If it's a complicated medical case, maybe our nurse or a lawyer has to do a little research to put some documentation into that letter to express to the insurance company why their doctor is wrong and your doctor is right. So it can be, like everything in healthcare, it can be more complicated than it needs to be.
So people gotta have a little patience there. What's the percentage of people not following through, or do they just give up?
Yeah, that's a really great question. And this is one of the things about, there's a lot of things about the American healthcare system that disturb me, but this is one of the things that really gets me. So there was an interesting study from the federal government a couple of years ago about a certain type of Medicare plan called Medicare Advantage plans. And only 1% of the denials were ever appealed.
Wow.
1% were appealed, because it's complicated and people have other things in their life. And when you're getting a big, heavy health claim denial, that means you're sick or a loved one is sick. So, you don't have time for a health care denial. You've got to work on getting yourself or your family member back to health. So, and guess what, though, Maricela? 1% are appealed, but more than 70% of the ones that were appealed were either fully or partly reversed.
Wow.
So you should take the time, and furthermore, if give the case to us so that we'll do the worrying, we'll take care of the paperwork.
So,
I mean, obviously you have to help us and
so
collaborate.
Messages to not give up, to
don't
stay
give up.
firm.
Exactly.
Let's go to our last question, and I would like to know if there's any new information or resources that you would like to share or add with our audience or the audience watching this interview. Anything new, anything that's come up that we would like to inform the people?
Yeah. So on the main part of our website, ct.gov/OHA, OHA, we do have a whole section there called "Lost Your Coverage." Have you lost your job? Have you lost your coverage? And if you go in there, we have a I think pretty nice suite of materials there for you to go through and understand all your options. Unfortunately, in America, everything's complicated. It's not a one-stop shopping deal at all. So you have to make serious decisions, and you have to have a lot of ability to research and understand. We can help people, by the way, as they're in that state of confusion when they've just been laid off or something of that nature. One of our case managers can walk you through your options and try to get you to the right place. But that Lost Your Coverage section on our website is a new resource that we're very proud of.
Very important. Okay, so that is all the time we have, Ted. Thank you so much for taking your time to join us this afternoon. And thank you again.
Thanks so much for your interest, and remember to tell your friends and neighbors about the free service.
Will do. Will do. Thank you, Ted. Bye-bye.
Thanks so much. Bye-bye.
Join us for another episode in 2 weeks. For more information about our discussion today, check out our web story on ctlatinonews.com. Follow us on Twitter at CT Latino News and Instagram at CT_Latino News. I'm Maricela Baez with CTLN Opinion Plus. See you next time. Bye-bye.